Brought to you in part by UnitedHealthcare.
Having health insurance has many benefits. Even if you're in good health, you never know when you might have an accident or get sick. A trip to the hospital can be much more costly than you might expect. The average emergency room visit is $2,200. So it really does make sense to get covered. Joining us now is Chuck Cerniglia from UnitedHealthcare, who has some tips on how to pick a health plan that is right for you. Whether you get your health insurance through work, on the exchange market, or are eligible for Medicare, you're going to have to make some decisions because it's open enrollment time. And for those who don't know what that is, can you explain it for us?
Well, open enrollment is a time each year when millions of Americans across the country have the opportunity to select or switch their health insurance plan for the upcoming year.
So what is the time frame in which people can purchase their health care? Is there a cutoff date?
Enrollment periods aren't the same for everyone. So there are key dates to keep in mind. For the 170 or 180 million Americans with employer-sponsored coverage, many employers set aside a 2 to 3 week period between September and December so that employees can make, healthcare coverage decisions for the following year. And for the 64 million people enrolled in Medicare, Medicare annual enrollment runs each year from October 15th to December 7th.
Okay, so we're getting into that sweet spot. What are some tips that can help people pick the right plan or even save money on their health care?
The first thing is people definitely need to consider all their options. I'd say the best first step is really to make sure you understand the health insurance lingo, things like premiums, deductibles, co-pays, co-insurance, and out-of-pocket maxims. These are all the items that really add up to your out-of-pocket cost in addition to the premium that you pay for the plan every month. And then for Medicare members specifically, as you weigh your options, you need to ensure you're familiar with the difference between original Medicare and then Medicare Advantage supplemental plan. The other thing is check your prescription benefits. Knowing how to get the most out of your prescription benefits, it may help you manage your costs. The other thing is check for mental health coverage. Now, in addition to in-person mental health care, you may have access to a large virtual network of therapists and psychiatrists that you can actually access right from your mobile device. In today's day and age, consider a plan with virtual care services. One of the bigger things is really anticipate next year's health expenses. If you're expecting a significant health event, such as a surgery or maybe the birth of a child, compare the differences in plan designs, for that specific situation, including any out-of-pocket costs. Those are the key things you need to consider when choosing a health plan.
There is so much to think about when choosing your health insurance. Where can people go for more information?
For more health insurance tips, you can go to uhcopenenrollment.com. We've created some really easy-to-understand videos and articles that will help people better understand health insurance and really prepare them for the open enrollment season, as well as learn some more about those words such as deductibles, co-pays, and co-insurance, which really relate to those out-of-pocket costs that members will experience.
All right. Thank you so much for all this information, Chuck. We appreciate the time.
Great. Thank you.